Welcome to the Sports Science Dudes. I'm your host, Dr. Jose Antonio, and my special guest today is Dr. Brittany Johnson. She is a registered dietitian nutritionist and a PhD scientist specializing in clinical research, evidence-based product development, and translating complex nutrition science into clear consumer messaging. With expertise across weight management and active nutrition, she focuses on credible, practical solutions, and most recently, advancing the role of dietary supplements, which we'll get into, vis-a-vis the GLP-1 era. She earned her PhD through Concordia University in Chicago. So welcome to the show, Brittany. I'm glad you're here.
Yeah, thanks so much for having me. I'm looking forward to it.
Now, can you explain for those who have no science background, because that's almost everyone, what exactly a GLP-1 is?
Sure. So, very high level, a GLP-1 is a pharmaceutical medication that people can inject or take orally that mimics a GLP-1 hormone that naturally occurs in our body to like a very potent degree. And it helps us suppress or reduce our appetite. So, you don't really feel hungry. It has a lot of other mechanisms too behind it, where it slows down how much your stomach empties or how quickly your stomach empties, which provides some of that fullness feeling as well. So that therefore it reduces your caloric intake. And then as well as playing on our blood sugar regulation. So it helps us control our blood sugars a little bit better than if we were to just consume regular food on a daily basis.
And it was originally a drug for type 2 diabetics?
Correct. Yep. So developed, it's been around for a long time. Obviously, I think with the social media era, you hear about all the Ozempic solutions, and now it's approved for weight loss as well.
Now, sort of generically, people use the term Ozempic to describe GLP-1s when in fact, there are many, many variations of this. So, and I've lost track. I don't even try to keep up with the literature in terms of what they are, but I guess, is there like a top 3 list of these are the primary peptides that seem to be used clinically and also seem to be the most effective?
I think it's all relative for the individual, and that's probably like such a science response because everybody's going to respond differently. We are individual people. But yes, Ozempic is sort of the branded name of semaglutide. So semaglutide is the actual active in that weight loss product or that type 2 diabetes product. Other ones like Mounjaro, that's the brand name. And then the actual active is tirzepatide. So that's
okay. I'll stop you there because that's the one I seem to be hear the most about. That, and say it again, it's tirzepatide.
Tirzepatide.
Yeah. That it's the one that promotes the most weight loss. And I don't know if that's true. This is what I hear or read. Is that true?
So tirzepatide does have a higher efficacy, or basically you do get more weight loss from tirzepatide based off the literature. Again, an individual response can be something that people experience different. I've heard both sides where tirzepatide has slightly less side effects on some things, where the semaglutide can have other side effects. Like you can have more nausea with semaglutide, but with tirzepatide, you may have less nausea. It really is an individual thing. Tirzepatide is a dual action, so it actually works on more. It works differently in the body than just the GLP-1 agonist.
Okay. Interesting. So both of us coming from an exercise background, I guess one of the most common questions I get or I hear relates to body composition. So you go on the drug, and I had this conversation with a friend of mine. The idea is you go on the drug, you change your lifestyle. And he said, well, the reason these people are on these drugs is because they don't change their lifestyle. Now, I don't know if that's true, but it kind of makes sense. Like, this is sort of last resort, you might say. So we look at body comp changes. So you go on the medicine. What's the data on how long are you on the drug? What are the body comp changes? Is there lean mass loss? Is it mostly fat mass loss? And then I would imagine people have to go off, or I don't know, maybe they stay on it forever. When they go off the drug, what's the weight regain like? And do they suffer from like hyperphagia where they just want to eat and eat and eat? I mean, there's so many things from just a body comp standpoint. It's like, I wonder what happens with all of these people that are on it. And then I'm thinking, well, what about a sports application? But we'll deal with that a little later. So address the body comp issue first.
Oh my gosh. Okay. There's a lot to unpack in that. However, it's all relative. So yes, Based off of like initial data, there was a large concern around the amount of muscle mass that's lost. However, due to the way we measure true muscle mass, we're only measuring lean body composition, which
Right.
includes your muscle or your bone and your muscle. So it's really hard for us to identify how much muscle mass specifically is being lost. Now, with that being said, it's sort of this 25% rule that no matter what way we lose weight, we are losing about 25% of that is going to be lean mass. How
Now
much of that?
that's without resistance training.
Correct.
Okay.
Correct. Yep.
Yeah.
So if you just don't do anything outside of trying to maintain that or even have a higher protein intake, if you just maintain regular protein intake, you're going to be losing approximately 25% of your total weight loss is lean mass. It's all relative, and so that's what more of the research is now saying that you are losing that lean body composition. However, it's relative to the amount of weight loss that you are losing. Now, again, to your point, excellent resistance training, higher protein intake can help preserve that lean mass during the weight loss. So, we definitely want to be advocating for resistance training as well as a higher protein intake during weight loss. To my knowledge, right now, we don't have any publications out there of clinical research where we see that in conjunction with the GLP-1 medication. I think there are studies, registered on clinicaltrials.gov that are happening. So that will be interesting to see, like, what is the most optimal protocol for exercise during a GLP-1 treatment. But I want to kind of talk about the weight regain part because I think that's the more critical component of body composition. So
Okay.
right now,
Well, how long are, well, I guess it's individual, but if you were to pick an average, how long are people on it before they go off it?
yeah, nearly 60% of people are stopping a GLP-1 within 1 year.
Okay.
That's
Okay.
the data that we have available right now, and that's often due to cost and tolerance to side effects. Again, it's all individual, right? Where some people might be coming off of it sooner than others. It just depends on what that individual experience is. But we do know, based off of a really large data of science, that most over 50% of people are stopping the GLP-1 within 1 year. And the data also shows that you need to maintain that drug in order to continue the benefit of weight loss, continue the benefit of blood sugar control. Because once you stop that medication, those benefits go away after time.
So most people stop it because of the side effects. They don't want to tolerate the side effects, or they're just like, I don't want to take this anymore. Does it matter if they're on an oral or injectable? Is there data on that?
That data is based off of injectables because oral solutions are relatively newer with these
Okay.
like next gen GLP-1s. We don't really know. I think there's like some studies that, or not studies, but just some people who are reporting that they actually are having worse side effects with the oral medication. However, the oral medication is being prescribed to people who don't truly need like a massive amount of weight loss. So that could be why they're experiencing slightly more side effects. We don't really have that data to show us what that outcome is yet.
Okay, so when they're off it, I don't know if you gave me a number. Is there an average? Do people on average regain 50% of the weight back? All their weight back? More than the original weight? Is there
Yeah.
a number to that?
Yep. So, based off of the data right now and sort of a prediction, because we only follow people about 1 year after they stop the GLP-1, is that you return to your baseline weight 1.7 years after you stop that medication. So it's pretty impactful if you think about it. If you don't do anything, don't change your lifestyle, you don't learn those behaviors to kind of carry on to help you maintain
Mhm.
that weight loss. And so I think that that's the part of the body composition I feel like we should be talking about more so than how much are you losing during the GLP-1 because it's a lot easier to gain back the fat mass that you lost and it's a
Yeah.
lot harder to gain back the lean mass that you lost, right? So we have this risk of what is called sarcopenic obesity, where you've gained back more fat mass and you don't have a lot of lean mass, which we know is really important for health.
Now, are there people who are so obese that they wouldn't, this is not something that would be prescribed? I mean, because now shows on people who are over 600 pounds are so prevalent that would it help them, or is there something else they should do first? And I guess the question is related to with that population. Let's take the 600 pounds and over population. Do you think preserving lean body mass during treatment is actually more important than just maximizing total weight loss. So if you're 600 pounds, do you really care if you lose lean mass, or is it let's just lose mass?
Yeah, I think it's just lose mass, right? Because if you're not even mobile, so you can't even really go exercise because maybe your hips hurt, your knees hurt because of all the excess weight that you're carrying. That's number one. We got to get some of that extra weight off of the pressure of your body, so then you can actually move and start some of those lifestyle interventions.
Interesting. Now, if you had unlimited funds and you could design a perfect trial, that includes exercise, dietary intervention, and supplements, because I think eventually I want to get to the supplement piece of
Yeah.
this because, like you said, there's no trials yet on whether you had protein, whether you had creatine. Although I have a friend who's in California, a physician who we actually wanted to do a series of case studies, and the challenge is this: it's we wanted to see if adding creatine and or protein would help. The problem is, as part of her being a physician, she always recommends that. So
Mm,
would it be ethical to not recommend it for the purposes of just seeing what happens? You have one group
right.
on GLP-1s, one group on GLP-1s plus creatine and protein. So that's sort of where we are clinically. Like as a physician, is that ethical to do?
Yeah, I mean, I don't think there's any like proof right now that we have available to where would it be ethical to not prescribe it. Obviously, for optimizing, we want to. But I think for that purpose as a practitioner, yeah, you want your clients to succeed. And we know there's enough available evidence on creatine that that is a good addition to somebody's routine and that journey. But for a clinical trial design, I mean, we have to exclude it to some degree because we need to have that placebo comparison.
Right, right, right.
It would need
Would you speculate that creatine and or protein would play a huge role? I guess let's take two separate populations, ones that train and ones that don't, and I'm guessing most don't. So
yeah.
would adding creatine and or protein help that population who are on GLP-1s?
I think we have enough available evidence right now on protein that having a higher protein intake during weight loss, regardless of if you're training or not, is beneficial. The creatine, I think that the benefit really comes from at least 2 days per week of resistance training. So being able to combine that, I know there's some data, especially in older folks, and then even like the cognition component, that creatine really helps that pathway without resistance training. But if we're talking about preserving lean mass, it's definitely we need that resistance training because that creatine helps just amplify that process. And I don't know, I just am such a lifestyle person that I want people to do the resistance training too. We know that creatine
Yeah,
is not just going to solve your muscle mass
no.
loss.
Right. Yeah, it has to be in conjunction with resistance training or some
Yeah.
sort of exercise. Now, are the majority of these in these clinical trials, are the majority of the patients, do they have other, I guess, health issues unrelated to just weight? They're just overweight, or do they have type 2 diabetes? Are they hypertensive? Does it treat, I guess, I was talking to a friend of mine who said it seems like, and this is anecdotal, that
Yeah.
not only does it treat the weight loss vis-a-vis lower hunger, but they have less alcohol cravings. They have other cravings that seem to diminish. And I was thinking, so, okay, so does that mean they don't enjoy life as much? It's like, does it diminish everything? It's
Ah,
like, yeah,
I have a friend who expressed that where she was taking the GLP-1 and she said, I don't feel motivated at all. I have no dopamine rush at all for anything. I just feel null. So I think there are some of those people that get impacted that way. But I think fundamentally, the weight loss is then producing the benefits for the blood pressure. The weight loss is helping produce the blood sugar regulations. So it's this downstream impact that's positive overall, by really working to help reduce some of the food noise, right? Like that is something where we know the data is showing GLP-1s reduce the food noise. So this constant, like, when's my next meal? I want a cookie after dinner, where that kind of goes out the window because they feel more satisfied of like, oh, I had my dinner. I'm fine. I'm not craving a sweet treat.
yeah, but the food noise makes eating more fun.
I know. I struggle with that too because I think that, we look at food so much as just the ingredients and just the health benefit. that we forget the joy around food of just like going to a nice dinner and having time with friends and family. I think about holidays, right? Like food is a big part of our culture. And so we don't want to miss out on that joy of life.
Yeah, getting together with friends, just to eat a nice dinner. I mean, it's been described, it's the social lubricant. It's what
Yeah.
gets us, it's what's fun. I mean, the annoying person, and you're familiar with this, is the one where you go out to dinner and there's that one person who won't eat. They bring their own food, they have their jug of water, and it's like, you're
Yeah.
not even enjoying life. You're like eating chicken breasts that taste like nothing with broccoli, which tastes like nothing, and drinking water.
Yeah.
So the social lubricant aspect, I think people, sort of forget, other than, because they're so focused on eating less because they want to lose weight. Now,
Yeah.
from a sports standpoint, this is where, when I look at weight class sports, and I don't know if you know much about fight sports, mixed martial arts, boxing or whatnot. Obviously, making weight is a big part of it, and it can be somewhat dangerous if you don't know what you're doing.
Yeah.
Are you aware of any fighters using even low doses of this just to help? They must have crazy cravings as they're cutting weight, before they get weighed in. Are you aware of anything related to that?
I don't spend much time in that world, but I'm sure it's happening. Especially so the closest where I can kind of look at that is women postpartum to lose the baby weight. Like
Okay.
they're using GLP-1 medications now to get them back to their pre-birth weight. So I can see that trickling over into a sports category, which I know there's conversations around, would this be considered a banned substance? Because you could use that as a tool to make your weight class 2 weeks prior, start taking a GLP-1 just to get your weight down is a lot easier than what the good old days where you'd throw a trash bag on and go run for an hour to sweat out any extra body water.
Oh, they're still sweating out a lot of body water. It's crazy. I mean, a lot of these guys look like zombies by the time
Yeah.
they weigh in, and I would imagine the cravings have got to be crazy once they make weight. Now,
Yeah.
I did ask you that about if there are crazy food cravings for those who go off the drug. Is that something seen in any of these clinical trials?
I haven't seen that be reported. The big focus has been on just the weight regain and the benefits staying with the blood sugar control. I have not heard the weight piece. From my own experience with friends that have used it, it does come back on, but not right away. So they have sort of a lasting effect of like, oh, I don't want alcohol, I don't want sweets. But it comes back from what I've seen and within about a month once that drug is completely out of your system.
Now, in your talk, you had talked about some micronutrient deficiencies that people have when they're on GLP-1s. Could you address that a little bit?
Yeah, I think overall, what we're seeing is that people are just eating less food. They're not eating better quality. And as we know, the American diet is not the most nutrient dense dietary pattern in general. So it's kind of obvious that they would be missing out on some of those big players that most Americans are missing out on. They just have a higher percentage of missing the mark
So
because
are
they're eating less.
so are they still eating less, but the same crappy food less? Is that what's going on,
Kind
basically?
of, yeah. When you look at their scope of their actual dietary patterns, it's still pretty processed foods, not a whole lot of fruits and vegetables, and lean proteins. One thing that I thought was really interesting is a lot of cheese and like beef sticks were being consumed, which I
Really?
think they think of that as like, oh, it's a protein source. Like cheese is protein,
Cheese?
not realizing that like no, cheese is mostly fat with a little bit of protein in it. So I think there's just misconceptions on what food provides to us too. But in general, you're missing out on big things like your calcium, your potassium, your vitamin D, your magnesium, your iron. And a lot of those is where a dietary supplement can really help move the needle because it can fill those gaps.
Now, when you compare GLP-1 therapy to just people losing weight on a diet, because we have plenty of data on diets, hypocaloric diets,
Yeah.
is the weight loss basically the same in terms of body comp changes?
Relative, I believe the data right now shows that GLP-1 users are losing slightly more lean body
Slightly more.
mass than
But,
your standard like intervention of just a lifestyle, like a hypocaloric diet.
oh, interesting. So you had mentioned earlier there's roughly a 25% of lean mass loss of the total, 25%. Whereas a regular diet would be what, 20%?
Yeah, there is some data that's published on the GLP-1 showing up to 40% of your lean mass is lost. But then retrospectively, they've gone back and said, well, it's all relative to the degree of weight loss because you are
Right.
losing more weight. For example, you're losing up to 20% of weight loss using a GLP-1, where if you look at just intervention based, so like a diet or exercise plan, you're losing anywhere from 5 to 7% of your weight loss. So you're naturally going to be losing more lean body mass when you're doing a GLP-1 drug because you're losing significantly more weight.
Okay, that makes sense. Now, sort of a social, I guess, sociology type question. The body positivity movement and the fat acceptance movement. It seems like, especially body positivity, there are a lot of people in the fitness space who talked about it. I don't see anyone talking about it anymore. So why do you think that is?
Yeah, I agree. I think it's just a wave. And I think that this is just what happens in our world where, like skinny is good and then body positivity. And then, oh no, we want strong bodies. And now we're kind of back to the skinny bodies, right? Everybody kind of, even celebrities are taking the GLP-1s now. So you see that and it's just in your face more. So I think that we'll circle back around to the body positivity maybe in the future because people are realizing like, oh wait, these GLP-1s are maybe sucking the joy out of my life.
Well, some of these celebrities who are on it look way too skinny. It's almost
Oh
like
yeah.
I mean, I would imagine their physician would say, I think you've lost enough weight. You might want to regain some of it back.
Yeah.
But I
I
guess some
agree.
people want to be, they want to be twiggy or whatnot. So,
Yep.
um, so final words of advice for people who are thinking about it, who may not be. I mean, in our world, we sort of have this weird perception of people because most people I'm around work out and are in shape.
Yeah.
And when we use the word, oh, I'm getting chubby or fat, it's not the same thing as people who don't work out. So is there an application for them, just sort of the average person? And let's say they want to lose 10 pounds, which I guess is a lot depending on who you are. Is this something a physician would prescribe for someone who's like, I just want to lose 10 pounds versus someone who needs to lose 50 to, 100 pounds?
Yeah, I don't think your provider is going to be prescribing it for those that only need to lose it for about 10 pounds because one, you technically don't qualify for it. That's something where you probably have to go to the telehealth compounding pharmacies to get that if you're an individual. I just don't think it's necessary for people who are only trying to lose 10 pounds. I think that that's where discipline of diet and exercise comes into play, where it's more of the long game. I think these medications are designed for people who truly need external help and support to lose a significant amount of body weight.
So how much weight would you have to lose to qualify for it? Now I know it's individual, but is
Yeah,
there a number?
they're based off BMI. So I believe you
Oh,
have to be a BMI of, I think, 30 or higher. So you have to be in that like obese class in order to truly get prescribed it. Some of the more recent, like micro dosing. So this is where you would take the medication like every other day if it's an oral solution. The BMI qualification is slightly lower, all the way down to 23. But I think in general, like we just need to get back to like grind it out in the gym, eat a little bit healthier, and you're going to lose that 10 pounds with some hard work.
what's funny is I have a lot of friends, including myself, whose BMI is close to 30. So not necessarily fat, but still, it's like,
Yeah.
we're kind of close to 30. So,
Yeah. It's not the best indicator as we know because it
yeah.
doesn't take into, consideration the amount of muscle that you have. But for right now, that's just what we have as a tool.
So any last words of advice for the audience in terms of where they can find out more information on GLP-1s, also where they can find out information on you? I don't know if you're giving seminars anywhere else, but please tell the audience if you don't mind.
Yeah, I mean, if you're going to Supply Side Global in Vegas in October, I'm actually presenting on GLP-1 and supplements because I think it's an underserved category that we can definitely provide more help for people. I think if you're considering doing a GLP-1, definitely work with the dietitian, definitely work with strength training coaches, and just find a way to be consistent, even if it's only 2 days per week. It doesn't need to be every single day that you're doing resistance training, but just move some weight at some point and
Mhm.
try to focus on getting some more protein and filling those nutrient gaps. And then, too, I mean, feel free to provide them my LinkedIn information, and I'm happy to answer any questions that may come through.